Imagine your body as a city. Every cell is a worker, keeping things running day and night. Now imagine that some of these workers slowly run out of energy before the whole city collapses. This is what can happen in people with advanced liver disease. The state of patients with cirrhosis can suddenly worsen, a phase called acute decompensation. For some, this progresses even further to a life-threatening condition known as acute on chronic liver failure. But what actually happens inside the body before this clinical deterioration becomes visible? To answer this, we zoomed in all the way down to single immune cells in the blood. Using single-cell technologies, we examined thousands of cells one by one, like checking the health of every single worker. What we found was striking. A specific group of immune cells, monocytes, shows a profound loss of energy production before patients develop organ failure. Their mitochondria, the cell's power stations, no longer function properly. These cells are still present, but they are running empty. And this wasn't just something we saw in a few patients. We found the signal of this monocyte-specific energy failure across large patient cohorts, and it was associated with infections, disease progression, and a lower chance of survival. What does this tell us? It shows that immune failure in liver disease is not sudden. It builds up silently at the level of cell metabolism. By understanding how immune cells lose their energy, we begin to understand why patients could become vulnerable to infections and why acute on chronic liver failure can develop. This deeper mechanistic insight can help guide the development of new therapeutic strategies aimed at preserving immune cell energy, protecting immune function, and ultimately preventing the progression from acute decompensation to liver failure. Sometimes, progress in medicine starts by understanding what drains the system long before it breaks.